Hello everyone. Hello everyone. Myself, Mr. Jangde Sanket Surendra, lecturer from Mula Education Society's Mula Rural Institute of Pharmacy, Sone. Where we will discuss the chapter Hospital Pharmacy, Part 2nd. The outline of this chapter, in which, in the part first, we have seen the definition of hospital pharmacy, functions of hospital pharmacy, objectives of hospital pharmacy, location, layout, flow chart for materials and men, personal and facilities requirement, equipment based on individual and basic needs. This point we have discussed in a previous lecture. Now, in this lecture, we will start with the pharmacist requirement, floor and space requirements, qualitative norms for floor area, equipment, requirements and abilities required for hospital pharmacists, etc. Pharmacist requirement. The manpower trained in a pharmacy varies with size of the hospital and the services it offers. The number of pharmacists required for a hospital or the number of beds available in a hospital and its occupancy rate. As the rule of thumb, it can be said that we must have a minimum of 3 pharmacists for a very small hospital. For 100-bedded hospital, we can have 5 pharmacists. As the number of bed increases, the number of pharmacists also increases, but not proportionately. In this chart, we can see according to the bed strength, up to 50 beds, 3 pharmacists are required. Up to 100 beds, 5 pharmacists are required. Up to 200 beds, 8 pharmacists are required. Up to 300 beds, 10 pharmacists are required. And up to 500 beds, 15 pharmacists are required. While calculating the number in very large hospital such as 1000 beds, 2000 beds, 3000 beds, the service points available for dispensing to the inpatient and outpatients are considered. The outpatient attendance as compared to the bed strength in hospitals is usually in the ratio of 3:1. For larger hospital, one pharmacist has been recommended for 33 patients. The operation research technique for waiting line theory can be profitably used for this purpose, though its discussion is beyond the scope. Now, starting with the floor space requirement. The total floors area of pharmacy depends upon the scope of its operations or the subunits forming for the part of hospital pharmacy. Floor space should conform to the norms laid down by the D&C Act 1940 under the Schedule M. The pharmacy requires a minimum of 250 square feet for any sized hospital. From that point onwards, basic estimates range from 10 square feet per bed in a 100-bed hospital, 6 square feet per bed in a 200-bed hospital, and average of at least 5 square feet per bed in large hospital. Teaching hospitals do require a large space. Qualitative norms for floor area are: the floors of the pharmacy should be resilient, smooth, easily cleanable, and acid resistant. The surface should not be non-skid. In manufacturing sections, drains should be provided. Walls should be smooth, painted in a light color. The cabins are enameled or laminated. Ventilation window blinds are favored. There should be adequate illumination. Fluorescent lamps are placed immediately above the prescription counters. Gas outlets are required on the work table or on the Bunsen burners. Equipment required in a hospital pharmacy. The pharmacist is the best judge about the equipment needed and their selection for a new hospital or for an existing hospital. The usual equipments are the prescription case, drugstore cabinet with proper shelves and drawers, sectional drawer cabinets with cupboard bases, work tables and counter for routine dispensing, sink and drainboard, cabinet to store mortars and pacers, cabinets for glass utensils, flasks, funnels and beakers, refrigerator for suitable capacity, narcotic safe with individual locked drawers, office desk with telephone connection and file cabinet, shelf space for pharmaceutical library, dispensing window for nurses and outpatients. Depending upon the type of manufacturing, the following equipments are also necessary, which consist of ointment mill, mixing machines, collapsible tubes, parenterals are prepared in separate rooms fulfilling the aseptic conditions, water still, etc. Workbench, cabinets, resistance glass storage tank burettes, sintered glass filters, bottle racks, adjustable metal shelf, double sink with drain board, pressure sterilizer, autoclave, hot air oven, etc. In quality control department, different instruments like spectrophotometer, hardness tester, analytical balance, viscometer, Carl Fisher apparatus for moisture content, etc. are necessary. Now, facilities required in a hospital pharmacy. In smaller hospital with one pharmacist, only one room is required for pharmacy, having a combination of dispensing, manufacturing, administrative, and all other sections of complete pharmaceutical service. For sterile products, there should be a separate room or area. In large hospitals, they are equipped with a water still, workbench, cabinets, tanks, burettes, etc. A separate area is required for inpatient services and unit dose dispensing and for the outpatients. An office for the chief pharmacist, a compounding room, pre-packing and labeling room, a store room, sterile product room, etc. Now, starting with hospital pharmacy has now been recognized as an important department for any worthwhile hospital. Naturally, it should be staffed by competent persons well trained in the profession of pharmacy. The better the caliber of the people employed by the pharmacy department, the higher will be the status of this department. So far, the hospital count upon the service of diploma holders in pharmacy. They form a core manpower. The graduates and postgraduates in pharmacy fight shy of joining a hospital pharmacy since there are better career opportunities available to them in an industry and they find the hospital work environment not so conducive to their professional growth and job satisfaction. To tackle this problem, the bulk of pharmacists who are employed in a hospitals today, being the diploma holders, should be well grounded in the subject of hospital pharmacy. Even then, the manufacturing, quality control, research, and development sections of hospital pharmacy requires the service of graduate and postgraduates in a pharmacy. till the time suitable freshers do not feel motivated to join hospital pharmacy function. The in-service diploma holders should be encouraged to take higher courses and on completion of these courses should be upgraded to senior position with better emoluments. The existing educational institutes should make a provision of few reserve seats talented fresh candidates who are B.Pharm, M.Pharms would come forward to accept position in hospital pharmacy. In the meanwhile, academicians should inculcate a sense of service and dedication in their students so that few accept hospital pharmacy as a mission in a life. Requirements: the head of the hospital pharmacy should be bright postgraduate in a pharmacy, preferably in a pharmacology and hospital administration. He is the coordinator of pharmacy and non-pharmacy staff workers under him. He reports to the administered and interacts with the medical departments. Here you can see the flow chart for pharmacy requirements of a hospital pharmacist, in which a director, superintendent of pharmaceutical services, or chief pharmacist whose qualification is the M.Pharm, then pharmacist for the drug distribution department whose qualification should be B.Pharm, then pharmacist in a medical store, two pharmacists either B.Pharm or D.Pharm for the dispensing units, and postgraduate pharmacist for the quality control. Abilities requirement: there are the various abilities which are required for the hospital pharmacist, such as administrative ability, teaching ability, ability to develop manufacturing sections, ability to control inventor, academic ability, and ability to conduct and participate. Now starting with the first ability, that is administrative ability. The head should have ability to plan, organize, direct and control the pharmacy function. He should have human relations ability to interact with other departmental heads. He is personal manager for his own staff. He selects, trains and guides them. He also evaluates them. He prepares work schedules for them. He is responsible for making hospital pharmacy a financially viable unit of the hospital by doing proper budgeting. He keeps legal and administrative records and uses the data for onward reporting. He develops a proper pricing policy for prescriptions. He brings an element of professionalization in the running of pharmacy. Second one is the teaching ability or technical ability. He is well versed in basic science and pharmaceutical sciences. He is an expert on drugs, their pharmacokinetics or pharmacotherapeutics. He knows well the storage department in terms of stability characteristics of different substances. His skills in handling drugs should be higher than his counterpart working on other organizations. He will inspire confidence in his medical colleagues about his technical competence. He has to assure quality of pharmaceutical products used in the hospital, especially the generic preparations of the medical staff. Ability for the exercise control over supply, quality, and cost. Besides, certain preparations not commercially available may be needed in a hospital. The pharmacist has to organize manufacturing function by doing proper cost benefit analysis. He should be able to attract suitable qualified in B.Pharm M.Pharms in pharmaceutics and microbiology for this purpose. ability to control inventory. Large inventories of drugs outside the medical stores remain lying at nursing stations, supply rooms, clinical units, etc. Enough control is to be exercised for this inventory in transit. Academic ability. The pharmacy staff acts as a trainer for the nursing staff. They develop suitable training materials and ability to conduct and participate in a research. The chief pharmacist also oversees the practical training skills for the conduction of and participate in a research. Here we are ending with the hospital pharmacy. Thank you. Thank you very much.